Knowing how to correctly start the OET roleplay can be a source of stress for many people, and unfortunately, a lot of candidates end up doing it wrong. Well, I'm here today to explain to you the best way to start the OET roleplay so that you can go into your exam feeling calm and confident. Hello everyone, my name is Grace and I am an expert OET teacher at Swoosh English. Now, the very start of the OET speaking test might not seem that important, but it can actually make a really big difference on your performance throughout the rest of the test. So it is super important that you know how to start correctly and confidently. So keep watching this video as I'm going to give you lots of tips and advice on how to do just that. So in this video, I'm going to talk to you about the best way to start your OET speaking roleplay. But first, let's begin by talking about why it's so important. Firstly, a strong first impression shows how competent you are at communicating with a patient, which is exactly what the examiner wants to see. It also affects your score for relationship building. So if you are familiar with the assessment criteria for OET speaking, you will know that one of the clinical communication criteria is how well you build a relationship with your patient or caregiver. And that can be demonstrated from the very start of the role play with your introduction. It also helps you to relax and feel like the consultation is authentic. And in that way, it will also make your performance more realistic and more believable as a healthcare professional. And finally, a confident start will help to grow your confidence as you work through the tasks in the speaking test. So overall, it should contribute to you getting a higher score at the end of the test. Now, I want to talk to you a little bit about what not to do. So the biggest mistakes that OET candidates make in their speaking test. Firstly, do not wait for the interlocutor to start the role play. It is your job to start the consultation, so make sure that you are the one who confidently begins the role play and you're not waiting for your interlocutor to start. Do not introduce yourself if it's not necessary. Now, I'm going to talk to you about that in a little bit more detail because there may be a consultation that you find yourself in where you don't need to introduce yourself. And finally, don't start the role play without any kind of introduction whatsoever. So even if you're starting halfway through, there needs to be some kind of introduction to what you're going to do next. Now, I know all of this may sound quite daunting, but don't worry, we're going to go through a few steps that you can keep in mind so that you can make sure that no matter what situation you find yourself in, you know exactly how to start the role play. So let's take a look at that now. How then should you make your introduction and start the role play? Well, let's look at the first situation. Now, if it is clear from looking at the role card that you already know the patient, or if the role play starts midway through the consultation, which can sometimes be the case, then you obviously do not need to introduce yourself. So the first thing you should do is read that role card and decide, do I already know the patient, or has this consultation already started? If so, you don't need to introduce yourself, but let's look at a couple of examples of what you might say. So, okay, Frank, now that I've completed the examination, I'd like to discuss my findings. Is that okay with you? This would be a great way to start a role play that's clearly already begun. So you've perhaps done an examination of your patient and you're then going to move on to the discussion. So this would be a perfect way to start. Also, you might say, hello, Michelle, thank you for coming to see me today. I understand you've been having some problems with your vision. This would be a great way to start a role play with a patient who you already know. You don't need to ask their name or introduce yourself because they already know you and you already know them. So these are a couple of ways that you could start this type of role play. Now, if we look on the other hand, it could be the first time meeting the patient, in which case you should briefly introduce yourself and also check the patient's name, which might look something like this. Hello, it's good to meet you. My name is Grace and I'm one of the nurses on duty here today. Can I call you Sarah? So here you've made a friendly introduction, you've introduced yourself, and you've checked the patient's name. So this is what you might do if you haven't met the patient before. Now, a question that we get all the time from OET candidates: how do I know which name to use? Well, the best piece of advice that I can give you is when you enter the OET speaking test and you are introducing yourself to the interlocutor, ask them their name. So just say, what would you like me to call you? And then use that name in the role play. That really is the best thing that you can do. Alternatively, if you want to just choose a random name and use that in the role play, that would also be okay. So don't stress too much about this. Ideally, before the role play begins, you check the interlocutor's name and just use that throughout the role play. You can even check, like I showed you in the previous example, is it okay to call you Sarah? Is your name Sarah? Or your name is Sarah, is that right? So then that way we have just confirmed with the patient that it's okay to use their first name. So that should answer your question, what name do I use in the OET roleplay? Another situation you might have to deal with in the OET roleplay is an emergency. So if you read the role card and you can clearly see that you are in an emergency situation, perhaps, for example, you're in A&E, you've got a distraught parent with you. In this situation, you don't want to have a very long introduction because it's really not appropriate for this type of role play. So make sure that you're aware if it is an emergency situation, you're not doing a very long, hello, my name is Grace, I'm here today to talk to you about your son. You want to keep it brief and to the point and then get started with the consultation, as that will be more important. So now let's move on to talk about how exactly you should start the consultation itself. Well, you need to explain who you are, if necessary, and what the nature of the consultation will be. Let's take a look at this example. So you can see from this example here that I haven't met the patient before. So I've introduced myself. It's good to meet you. My name is Grace. I'm one of the community nurses. Can I call you Sarah? My patient or interlocutor says yes. And then look at what I say next. I'm here to check on how you've been doing since you were discharged from hospital, so I'm just going to ask you some questions. Is that okay? Now, if we break down this very beginning part of the role play, you can see that I've done several things to get the consultation started. I've introduced myself, I've said who I am, I've checked the patient's name, and then I've explained what the nature of the consultation will be. And I've just checked that it's okay for me to ask the patient some questions. So you can see here that in quite a short space of time, I've actually had a really strong opening to the consultation, and then I can begin with the tasks on the role card. So now let's take a look at a sample role play. If you'd like to, you can take a moment here to pause this video and study the role card, take a look at the setting, take a look at the tasks, and then think, how would I start this role play? You need to consider, do you already know the patient, and is it an emergency situation, as these two things will affect how you open the role play. So have a go, pause the video, and once you've decided what you will say, you can continue and see what I would say. All right, let's have a look then. So I think an appropriate opening for this role card would be to introduce myself, as it doesn't say that this is a patient that I already know. It's not an emergency situation, it's just a normal consultation. So I've said, hello, my name is Grace, I'll be looking after you today. I've checked the patient's name. Your name is Peter, is that right? And then I say, I understand you've been experiencing panic attacks. Could I ask you to explain a little bit more about them? So you can see that I've explained that I will be the nurse who is looking after the patient, and then I've given a little introduction as to what we're going to talk about. So I know the patient is going to talk about panic attacks, and then I've opened with a question. So this would be a great way to start this particular role card. Now we're going to take a look at a second one. So here you can see we've got a different setting, different task. Again, you're going to ask yourself these two questions. Do you already know the patient? Is it an emergency situation? So take another moment now to think about this, have a go at opening the role play, and then continue with the video. Okay, let's take a look. So you can see that you're making a home visit to a patient and you have just completed an assessment of the patient's needs. So this consultation is kind of starting halfway through. You will already have met with the patient and his or her spouse. So you can just begin by introducing what's going to happen next. Hello, Jerry. I've just finished your wife's assessment, so now I'm going to talk to you about options for full-time care. Is that okay with you? So I'm just introducing how the nature of the consultation will be. I'm checking that the patient is okay with that, and then I will begin with the task. So you can see how this is quite a different opening to the previous role card, but it still satisfies that need for some kind of introduction here. So let's end with some final reminders to make sure that you always start your OET roleplay correctly. First, start by reading the role card and check to see if you already know the patient or if the consultation has already started. If not, you can introduce yourself and make sure that you check which name the patient wants you to use, or use the name of the interlocutor. That's also fine. If necessary, briefly explain what the nature of the consultation will be. Remember, if it's an emergency situation, don't waste time on a very or unnecessarily long introduction. Always consider how the patient might be feeling. It's very common to get a patient who is perhaps a bit anxious, stressed, nervous, maybe even angry. Keep this in mind when you begin the role play, and always remember to smile and be friendly. If you're looking for more help and support with your OET preparation, then I would like to invite you to join our free OET Masterclass. It's super easy to get signed up. All you have to do is click on the link that you'll find in the description below this video and register for that class absolutely free. In the class, you can expect to get more tips and advice on how you can properly prepare for and pass your OET exam with the help of Swoosh English. So please do join us in that class. I hope to see you very soon. In the meantime, happy studying and thank you so much, everybody. Goodbye.